Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence-based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real-world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students, and that's what I intend to do with this podcast. On today's episode, I have some special guests from my university's undergraduate nursing research and evidence-based practice course. Demi Billings, Genevieve Davis, Andie Jo Dyer, and Abbie Gala are joining us to discuss their evidence-based practice project. Before they get started with their discussions, however, I want to let our listeners know that I have shared a copy of this group's evidence-based practice poster to accompany this podcast episode. You can find this in the show notes on whatever podcast platform you're currently listening to. Now, without further delay, let's turn the show over to Genevieve to get us started.
Hello, everyone, and welcome to our podcast. My name is Genevieve Davis, and on behalf of my group members, I'd like to thank you for joining us today. In this podcast, we will be discussing the work we have completed within our undergraduate nursing research and evidence-based course. Our project is solely focused on the breast milk and how it is a protective agent against necrotizing enterocolitis within low birth weight infants. My team members, Demi Billings, Andie Jo Dyer, Abbie Gala, and I are all a part of the undergraduate nursing program here at McNeese State University and would love to share the research we have collected pertaining to our project. We have all worked hard and researched many articles and found lots of evidence that supports our project. We hope you enjoy. Now it's time to sit back, relax, and enjoy this segment on the effects of breast milk within low birth weight infants diagnosed with necrotizing enterocolitis.
Thank you for introducing your team and for presenting your project topic, Genevieve. Necrotizing enterocolitis is a serious concern in the care of low birth weight infants, and your group's focus on the protective role of breast milk is both timely and clinically significant for neonatal practice. To help our listeners understand why this issue deserves careful attention, Demi, can you begin by sharing the problem that your group set out to address, and why is this important for us to explore?
My group and I selected this project because we wanted to further explore the effects human breast milk could have on necrotizing enterocolitis, especially since it is a condition we learned about in our pediatric course this semester. Necrotizing enterocolitis, which I will also refer to as NEC, remains a critical and emergent condition that frequently affects neonates, particularly those that are low birth weight. With this condition, portions of the intestinal tract become damaged and die, which leads to several complications in newborns, the most common one being infection. These infections are typically treated with bowel rest, meaning we will have the patient maintain an NPO status, the use of a nasogastric tube to relieve pressure, IV fluids, and antibiotics. However, in severe cases, surgical intervention is required to remove the necrotized portion of the intestine. This surgery can result in short bowel syndrome due to the bowel resection, which may require the use of an NG tube or a colostomy either temporarily or permanently. The mortality rate remains high, at approximately 20 to 30%, which shows the seriousness of NEC if not promptly treated. It can lead to life-threatening infections and can drastically affect subsequent somatic growth, neurodevelopment, and even future achievements of infants with very low birth weight. Among various preventative strategies, the use of human breast milk has emerged as a promising approach to reduce the incidence and severity of necrotizing enterocolitis, potentially avoiding the need for such extreme interventions. Human breast milk offers undeniable benefits due to its immunological and nutritional properties, which provide protection against numerous complications. It is believed that breast milk may help prevent intestinal inflammation and microbial imbalances by supporting the infant's immune system and gut health, thereby improving outcomes or reducing the risk of developing NEC altogether. Numerous quantitative studies have explored this relationship, aiming to measure the effects of breast milk on the incidence and severity of NEC in low birth weight infants. The goal of our review was to identify strategies that improve outcomes for this vulnerable population and reduce their overall risk. This topic is important and relevant to the profession of nursing because in order to have better patient outcomes, we need to be properly informed and aware of best practices so that we can properly educate our patients. As nurses, we are in the best position to provide this type of education as we have the most interaction with the patients and their families. By exploring the protective effects of human breast milk against NEC and using what we learn, it will have a direct impact on the care, advocacy, and education nurses are able to provide to this vulnerable population and will ultimately improve patient outcomes, which is the main goal.
Thank you for outlining the problem so clearly, Demi. Your explanation of the background surrounding necrotizing enterocolitis and the range of treatments from bowel rest to antibiotics to more severe cases that require surgery, that really highlights just how serious this condition can be for low birth weight infants. With that background in mind, the next step in your project was to shape a focused, evidence-based practice question to guide your search. Demi, can you share the EBP question your group developed and how it helped direct your investigations?
Now that we've established the significance of this evidence-based practice topic to the nursing profession, I want to share our group's evidence-based practice question with our listeners. We crafted our question in the PICO format to include the population, intervention, comparison, and outcome. The population we focused on was low birth weight infants, with the intervention being the provision of human breast milk, whether that be mother's own milk or donor human milk. The comparison in this study was formula or any other alternative that was not human breast milk. The outcome that we were looking for was the overall health outcomes for those with necrotizing enterocolitis or at risk for contracting necrotizing enterocolitis. The question that guided our literature search on our project was this: does human breast milk help lower risk and improve health outcomes in low birth weight infants with necrotizing enterocolitis?
Thanks for sharing your group's PICO question with our listeners, Demi. This question served to focus your group's investigations into the literature. So can y'all tell us more about how you used the PICO question to help you find published research studies about your selected topic?
My group's literature search was conducted based on our research topic's evidence-based practice PIO question. The question we wanted our research to answer is, does human breast milk help decrease the risks and improve overall health outcomes in low birth weight infants with necrotizing enterocolitis? We searched the following university library databases: Academic Search Complete, Alt Health Watch, APA Psych Info, CINAHL Complete, Health Source Nursing Academic Edition, Medline, Psychology and Behavioral Sciences Collection, and the SOC Index with full text. Our group searched using a variety of keyword combinations such as necrotizing enterocolitis in low birth weight and breast milk, NEC and LBW in milk, prevention in necrotizing enterocolitis, prevention and NEC in low birth weight, necrotizing enterocolitis in human milk, necrotizing enterocolitis in human milk, and LBW. We had to play around with the combination of words and abbreviations to find the data that perfectly correlated to our desired question and answer. We set specific search limiters on our searches, including full text, peer-reviewed, published in the last 5 years, in the English language. The literature search went very well overall. Our biggest struggles actually stemmed back to our PIO question because the population low birth weight started being used interchangeably with the preterm newborn population. The difficulty lied in the fact that they were not the same population, but preterm newborns are often very low birth weight. Eventually, we weeded out the ones that were pertaining more so to an infant's low gestational age and directed our attention to the data involving infants, preterm or not, with low birth weights.
Andie, thank you so much for walking us through your search process. Your group's experience highlights an important challenge in neonatal research. Terms like low birth weight and preterm are often used interchangeably, even though they really don't represent the same population. It's good to hear that your team took the time to examine each study very closely to ensure that it truly aligned with what your EBP question was asking. So now that the literature had been gathered and then evaluated, let's move into what the evidence actually revealed. Genevieve, let's get back to you. Can you share the key findings that your group identified?
After conducting our literature search using the methods previously described by Andie, we went through each of our study articles and found high-quality studies that pertain specifically to our topic. These studies addressed our evidence-based practice question of whether or not human breast milk does in fact lower the risks and overall improves health outcomes in low birth weight infants diagnosed with necrotizing enterocolitis. Each member was responsible for critically appraising study articles, and we all worked together to synthesize these studies in order to make our synthesis table. This allowed us to all get a bigger picture of the state of the science surrounding our topic. Within our key evidence, it was found that across all evaluated studies, human milk, whether that be mother's own milk or donor breast milk, showed consistent protection against necrotizing enterocolitis within our selected population of low birth weight infants. Now you may be wondering or asking, why? How does this affect these infants and how does it protect them? Well, we have found in our research that many non-experimental or observational studies have been conducted to give better insight on this question. With the use of breast milk, these have certain immunological features within them. They help boost the infant's immune system by passing immunoglobulins and protection. Because these babies are born being below average weight or having a low birth weight, this increases their risks of complications along with increasing the risk of necrotizing enterocolitis. So these babies need all the nutrition they can get. Our studies also suggest that early and unnecessary formula introduction can actually increase the risk of necrotizing enterocolitis, while holding off formula until at least 34 weeks post-menstrual age was related with less complications. All 4 of our studies have been solely focused on low birth weight infants who are at high risk of necrotizing enterocolitis. Each study has done very similar interventions to get a better understanding of why that is. They also have minimal differences in feed schedules, delivery methods, and the effects of the QI strategy. The overall answer we have found with each of these studies was the nutritional advantages of breast milk and how that has created protection against necrotizing enterocolitis. Within our studies, they have also compared the use of formula with the use of breast milk. When using formula, the baby has a harder time digesting the quality, versus with breast milk, it actually aids with digestion and naturally allows for the absorption of all necessary nutrients needed. This answers our big question of how breast milk is essential for decreasing the risk of necrotizing enterocolitis within low birth weight infants.
Okay, thank you for summarizing those important findings, Genevieve. The consistency of the evidence that you described, showing that human milk, whether from the mother or from a donor, offers meaningful protection against NEC, speaks directly to the vulnerability of low birth weight infants and the critical role of immune support in this population. Your point about the increased risk associated with early formula introduction further reinforces how significant those feeding decisions can be during that neonatal period. With these findings in mind, it's essential to consider what they mean for nurses who care for this high-risk population day in and day out. Andie, can you share the nursing practice implications that your group identified?
Based on the information that my group and I reviewed, several key synthesized implications for nursing practice emerged. The primary targeted audience would be NICU and birthing facilities, labor and delivery nurses, and any other healthcare provider involved in a woman's postpartum care. The most basic intervention that can be made, if not being done so already, is lactation consultations. Other research shows that women who are taught one-on-one about the pros and cons of breast milk versus formula feeding are more likely to stick with breastfeeding or change their minds to do so. We also felt that the new mothers who were unable to breastfeed for any reason should be given the option of human donor milk for their newborns rather than formula, and that facilities and nursing staff should also advocate for the use of human milk exclusively. Reason being, the limited number of studies and the smaller population samples that were used, as this is indicative of knowledge deficits overall. Recently, a personal friend of mine was pregnant, unplanned, for her first child at 19 years old. She was considered a high-risk pregnancy and was sent directly to the hospital for a C-section after her last OB visit. Her baby was in the NICU of a facility located in another city for 2 months. During this time, she was diagnosed with mastitis and put on antibiotics. However, the nurses caring for her did not inform her of the risks or prevention methods related to losing her milk supply, which is what happened. Even after conducting her own research and trying a variety of techniques, she was unable to restore her milk supply. The nurses provided her with baby formula and supplements that would be added to the feedings, but not once did anyone offer another form of breast milk. This, alongside my group's research, is indicative of the need for education to patients about lactation and alternative feeding options.
Andie, thanks for highlighting those practice considerations. Your emphasis on providing early lactation support, along with offering donor human milk when breastfeeding is not possible, all of that underscores how vital nursing education and advocacy are in preventing NEC. Abbie, your personal example about your friend also reinforces how gaps in lactation guidance can have real consequences for navigating this newborn period. Beyond current practice, your group also explored areas where further study might be needed. So, Abbie, can you share the research implications that your team identified?
There are still some knowledge gaps remaining in the published literature surrounding our topic. Therefore, our group did develop some implications for future research. Based on our findings, future studies should focus on evaluating the long-term outcomes of using donor human milk programs in neonatal units, tracking NEC rates over time in relation to feeding practices would help clarify causal relationships and further validate the protective role of human milk. Another important area for research involves education, both for staff and parents. Studies could examine how early education and the benefit of human milk influences feeding decisions and health outcomes in very low birth weight infants. Additionally, since donor human milk programs have proven to be cost-effective and life-saving, research should explore how expanding these programs across different healthcare settings might improve equity and accessibility for families. By addressing these gaps, future research can strengthen evidence-based practices and improve survival and developmental outcomes for infants at highest risk of necrotizing enterocolitis.
Abbie, your group identified several important areas for future study, such as evaluating long-term outcomes associated with donor human milk, tracking NEC trends over time, and examining how early prenatal feeding education might just improve equity and access for families who may need donor milk. These are meaningful directions that could strengthen the evidence base and support more informed neonatal care overall. So to bring all of this together, Abbie, I'll turn it back over to you to share your group's conclusions and your parting thoughts with our audience.
After all of the research studies that our group reviewed, we were able to determine an evidence-based answer to our EBP question. Does human breast milk help lower risk and improve health outcomes in low birth weight infants with necrotizing enterocolitis? What we found was pretty powerful. Across all of the studies we looked at, both donor human milk and mother's own milk showed clear protective effects against necrotizing enterocolitis, or NEC. These infants, especially those born with very low birth weights, have fewer complications when human milk was used compared to formula. On the other hand, studies that included early or unnecessary use of formula showed an increased risk of NEC. This is largely because formula doesn't have the same easy-to-digest and immune protective properties that human milk does. Even small delays in introducing formula, waiting until at least 34 weeks post-menstrual age, seem to lower the chance of complications. So overall, our review strongly supports that using human milk, whether from the baby's mother or a donor, plays a crucial role in preventing NEC and improving outcomes for the vulnerable population. One big takeaway for us was realizing just how much evidence-based practice, or EBP, shapes the quality of care we provide. It's not just about knowing what works, it's about understanding why it works and applying that knowledge to real clinical settings. Through this project, we've learned the importance of staying up to date with current research and using it to guide nursing decisions. As future RNs, we can use what we learned here to advocate for practices that support breastfeeding, donor milk programs, and prenatal education in the NICU. Ultimately, this experience reminded us that research doesn't just live in journals, it directly impacts the care and survival of our patients.
Good job summarizing your group's work so clearly, Abbie. The evidence you reviewed offers a compelling message. Human milk, whether maternal or donor, provides meaningful protection against necrotizing enterocolitis when compared with formula. And even small delays in introducing formula can really help reduce the risk of complications in the low birth weight infant population. Your group also emphasized an essential takeaway for future practice. Evidence-based practice directly influences the quality and safety of patient care. Staying current with research, questioning long-standing routines, and advocating for policies that reflect the best available evidence are all critical responsibilities for every nurse, especially nurses who care for our most vulnerable populations. Neonatal nursing requires both skill and vigilance, and integrating strong research evidence into practice helps ensure that infants and families receive the safest, most effective care possible. Finally, if you're a new listener to this show, Nursing Research Tips, I encourage you to check out other episodes. This show features multiple guest episodes just like this one, where undergraduate nursing research students share their EBP projects. There are also other tutorial-type episodes that share more background information regarding what EBP and research are and why they even matter to nurses in the first place. To our listeners, thanks so much for joining us in this important discussion. We hope you'll join us again soon.